Dr. Hunt, welcome to the show. The Catholic Medical Association. Dr. Tabali, welcome to the show.
The Catholic Medical Association. Doctor, welcome. Thank you very much.
Infectious disease specialist and Catholic Medical Association board member, Dr. Thomas McGovern.
She is also a member of the Catholic Medical Association's Health Policy Committee. Doctor, welcome to the show.
We're trying not to overwhelm our medical infrastructure. If we have a very high rise and spread of the infection throughout the population, we'll experience much of what happened in northern Italy, where their medical facilities were overrun. We need our medical providers on the job caring for individuals who are ill.
What do you tell folks scared to come into the office?
Well, we are actually screening them as they go in, and we reassure them that for those patients that need to be seen for chemotherapy or for blood work, that we are taking the measures using protective equipment and also doing the necessary cleaning so that the safety of their care is assured.
When we look at mental health issues, we look at these from a biological, psychological, social, and spiritual dimension.
As a medical professional with working knowledge of infectious disease, how effective is wearing a mask while in church, especially the masks that you and I have seen around town running errands?
That's an excellent question. On Dr. Doctor, our radio show, we've done a number of conversations about that. And what you learn is that the regular masks probably do very little to protect the wearer, but they do something to protect the other people from the wearer.
What do we know so far about this connection between COVID-19 and this condition in children?
We're having cases that are being newly reported now, and it's actually quite rare. So it's on the horizon. It's what we're watching.
Now we have to make our own schedule. I think that's part of the important process in dealing with what's going on. So when you make out your schedule, you make out your time for devotions, Bible reading, for saying the Divine Mercy Chaplet at 3 o'clock, which most of us are now able to do because we're home.
What I've noticed in our care of the patients with COVID-19 is that they seem to come to us sicker. Their ability to retain their oxygen levels is much poorer, and they seem much more medically fragile.
Testing has been our biggest issue, and that's been the biggest bottleneck, and it's a critically important piece to the public health aspect of this.
Telemedicine, we've seen it being used more and more now. Is it, in the terms of your cancer practice, is it effective or not?
It has become effective. For instance, for those patients that don't need to be seen because it's basically to go over medications, to go over lab results, test results, it's released part of the stress that they feel for coming into the office.
My heart and my prayers go out to those who have been affected by losses from the coronavirus.
Dr. Hunt, thank you so much for coming on the show. Definitely trying times for many of us. We appreciate your insight. As a Catholic physician, can you talk about your faith a little bit and how it's helping you during this time?
My faith animates everything I do, and my father, who recently passed away, taught us that we need to see Jesus Christ in our patients. And that's what I try and do. It's an incredibly isolating experience to be sick with COVID-19 and just trying to be present to the patient as much as possible and try and care for their every need.
As a Catholic physician, how does your faith, if I may ask, how does it help guide you, especially during these very difficult, uncertain times?
I like to pretty much continue in prayer on my way to work, and that really settles me down. And I remember that prayer as the day goes by. It has been a source of strength in me.
Well said, and best of luck to you. Dr. Felix Rodriguez, thank you very much.